So, welcome to the program, Doctor, and it's honor to have you.
Thank you, Lakshmi.
So, Doctor, you're widely known as a pioneer in pediatric neurology, having shaped care for thousands of children across the globe. So, when you look back, what exactly pulled you into child care and neurology?
Yeah, while I was training in PJ Chandigarh as a pediatrician, and then after that, when I was working as a senior registrar, I used to see lots of child neurology patients, and there is so little that we could answer their questions. So that's when I realized that there is a huge need for this specialty to grow. At that time, there was no pediatric neurology training program in India. So I did my adult neurology from NIMHANS and then went to UK for pediatric neurology stint for 4 years and then came back to serve our people.
So, we all know that pediatric neurology is both emotionally demanding and complex. So, what has sustained your passion over the years in this field?
It is my ikigai, I would say. I would keep telling the same thing to everyone. It is something I would love to do that help the families. And then at the same time, I don't feel it is a job for me. It is a service what I am doing. So when it is a service, it never tires me. I worked 12 hours a day, 14 hours a day. And people say at the end of it as well, you keep smiling, you keep doing the work at the same intensity. It's just because I never felt that's a work for me. It's a service. And that service keeps me going.
So, was there a moment in your journey when you realized this is exactly what I'm meant to do?
Yeah, I think the way when I started, I was one person with a physiotherapist. And then when I could build up to a service where we had 6 consultants and we had a training program for almost last 12 years. And we have built up one of the best pediatric neurology training program in India. So that the multiplication of number of people who can do service in pediatric neurology across the country is what is very satisfying for me, more than just treating individual patients, because you are multiplying your effect.
So, for parents watching this, what are some common neurological problems that most of the children suffer today?
So they can be as simple as epilepsy, which can be difficult to treat. So epilepsy sometimes, only seizures, you can give medications, but there are lots of epilepsies which can become complex and they are difficult to control. You are not at all able to control. So those are the things where you might require diet management, you might require surgical management. All those things have to be done. So epilepsy is one common part of it, and any causes of developmental delays. So the reason for it sometimes becomes a challenge. So if some things can be picked up on a brain scan to say, okay, this is the reason for developmental delay. Sometimes the scan is normal. There is no problem at the time of birth. And then you don't have any other obvious reason. Then you start down the genetic pathway to look at the genes what are causing the disease. So despite that, you might not find an answer. Then they become complex because you don't have an answer. What are you looking at? And what else can be done to answer and help these families? So it comes as just a simple word as developmental delay, but when you're trying to tease out things, it starts becoming complex. And there are children with various movement disorders. So movement disorders is even more complex because there are not many medications actually help them. And it's very, very challenging to have an improvement in their functional activities. So that's a big challenge in movement disorders. So having some time, the sort of maybe movement disorders can be medications, can be physiotherapy, can be surgical like deep brain stimulation as well. In select cases, the deep brain stimulation might be a good option. So we can have a combination of everything at one place and then evaluate them holistically. And then you have the acute stroke in children. So although it's extremely rare as compared to adult population, but when they happen, they are damaging the growing brain. When the growing brain is damaged, the impact is for lifelong. Whereas somebody at 80 years having a stroke, the lifespan effect is less. Whereas a child of 5 years is having a stroke, lifespan effect is another 60 years or 70 years, that effect is there. So that's why you need to act immediately, do the investigations immediately, get the results within a short span, and then see what kind of interventions needs to be done. So all those things needs a comprehensive setup. So when there is a comprehensive setup to do all these things, we can achieve better goals in these children.
But neurological disorders in children, do you think it's always running in the family or in the genes? Or do you think our lifestyle habits are to be blamed for, especially in today's world?
Yeah, I think it also depends on what particular disease you are looking at. If you are looking at autism, initially, I'll just give this example always. When I was training in 2002 in NIMHANS, my professor called and showed me, see, this is how a child with autism looks like. This is how the behaviors are. And so today, we see around 10 children in a single day.
With autism?
With autism in a single day, 10 children. So whereas in 2002, 2000 to 2003, when I was training, I could see one child.
It was mostly in the books until then.
Yes. So what has changed so significantly? It's our lifestyle. And during COVID, it multiplied 3 times. We used to diagnose 50 a month. We are diagnosing 150 to 200 a month. Which, what was it telling us? It was a change in the lifestyle. So all the socialization had stopped during COVID. You have to isolate yourself and children. So sometimes the parents got the disease, children didn't get it. So they're separated from each other and nobody to interact. Significantly increased gadget time during that period. So when there is a significant increased gadget time, you are interacting only with the gadget. You don't have to respond to the gadget. So you internalize everything. So your connections, actually literally the synaptic connections in the brain, are not developing to have interaction or look at a person's face and then smile, because that is only reciprocative. So if you are not developing that kind of environment, you don't have people to interact with. So you're in front of something which doesn't require your recruitment. Then it develops in such a way that you are actually not wanting to interact, and you develop slowly the features of autism. So it is extremely essential. They say African proverb is there. You require a village to raise a child. What does that mean? That you require a whole gamut of people of different ages, different experiences to stimulate the child's mind to develop that connectivity. First 3 years of life are extremely important for these children. So make sure you get enough social stimulation, enough spoken words with emotion, and stimulate them. Keep away 0 gadgets, reduce sugars or no sugars in those period. All those things will help us to reduce the incidence of autism significantly. And epilepsy, yes, the causes can be before birth in the form of genetics, around the time of birth in the form of reduced oxygen supply, reduced sugars at the time of birth, and then postnatal you can have injuries, meningitis, all those things. They can cause epilepsy.
So we often hear that a diet can make or break a child's growth. So from your perspective, what are some few non-negotiable rules that parents should follow as far as diet is concerned?
Yeah. So the things to avoid, as I said, is sugars definitely in first 2 to 3 years of life. Almost many of the countries say 0, almost. Okay. And then the things to avoid would be any processed food. It be biscuits, chocolates. They say 0 sugar, but most of the biscuits would contain some amount of sugars. And cold drinks, cakes, all those kind of things will give an instant spike in energy and reduce your attention span. Gluten, if you have sensitivity, definitely avoid it. But it's difficult to see a sensitivity in such a young child. But if you give something containing gluten, chapati or something like that, and within half an hour time, the child has become significantly hyperactive, probably avoiding it for 3 months and assessing the response would be a good thing to do. Similarly with the milk, so some children become hyperactive after you give the milk. If they're consistently becoming hyperactive after the milk, give a trial for 3 months strictly without milk and see if there is a significant difference, you can continue it for longer. But if there is no significant difference, you can reintroduce the milk. So both for gluten and casein, these are the 2 important things parents have their concern. So if you have consistent observation that yes, after giving this, my child is hyperactive, then try to avoid that and strictly for 3 months, reassess with the doctor and the therapist, and then see whether you need to continue that restriction or you can reintroduce those food.
So basically, we need to watch what goes into our child's mouth and see how they react or respond over a period of time.
How they respond, yes. And what to be given, they can have all of the dry fruits, they can have fish, chicken, egg yellow is important, because a developing brain requires a lot of fat, which has a good quality and quantity of fat in the egg yellow. All those things, along with the wide range of fruits and vegetables, all those things will be good. A healthy diet which is cooked at home would be something very ideal.
So another big piece of the puzzle is sleep. So how important is a good sleep for overall child's development?
Very important point you brought up. So there's a child who came here with some abnormal movements of the eyes. When I looked at her eyes, the eyes were sunken. So I asked, "Are you not sleeping well?" She said, "I'm sleeping around 11:30, 12 in the night and waking up at 6. Absolutely not done. School going children, they should have at least 8 to 8.5 hours of sleep. Extremely essential to do that. If you are not doing that, you are absolutely, you're not able to retain what you are learning, because all your retention happens what you have read in the sleep. So you have to have good quality of sleep for you to be fresh the next day and able to pay attention to the things. So duration of the sleep, quality of sleep, both are important. If you are waking up frequently for whatever the reason, you are having repeated coughs or some other thing, waking up repeatedly, that also interferes with the quality of sleep. So a good quality 8 to 8.5 hours of sleep is extremely essential for children. Most of them should be hitting the bed before 8 o'clock to 9 o'clock, so that they can have a good 8 hours of sleep.
So next, let's talk about stress and anxiety. Do you think stress and anxiety exist in child's world or just like adults do?
Now, I would say that's a very good question, actually. We see children who come with headaches, tummy aches, abnormal movements. You do all the tests in the world, they are all normal. Then you start looking at where is it coming from. You ask the history. The child was scoring well. He scored a little bit less. And then he was moved from category A to category B in the classroom. So this differentiation, which means that he is degraded in front of his classroom, he is been downgraded. So that is obvious to everybody. That is a big stressor for a child. So we as physicians or pediatricians don't suggest this grading them and separating them. So that is absolutely not good, because it is putting in the mind of the child that I'm not as good as somebody else. Education is not comparison. Education is about imparting knowledge to the children. So it should remain like that. It should not be something where you grade them and differentiate them. I'm sitting here today, you are sitting there today, both of us are happy, successful with what we are doing. Does it matter what I scored in 7th standard? It doesn't matter. We should realize that. Never differentiate them. Never differentiate them. Make them grow as individuals in their own areas. Each one of them has their own abilities. How can we differentiate at that young age? So these young minds are very sensitive. You need to have that holistic development of children. So we need to bring that. So stress is definitely anxiety, performance anxiety, because if somebody is putting pedestal on the how much marks you are getting, and hierarchically you are putting them, so that is not good. So you should treat them equally. Marks are not very relevant at that young age. Only when it comes to a competitive level of exams that matters. Before that, I don't think so. It should be something which has to be used to differentiate the students.
So I believe a happy and a healthy environment is more important than anything else for a child's overall well-being.
Absolutely, absolutely. No two thoughts.
So before we conclude, Doctor, what is that one message you would like every parent watching this to remember?
Well, the most important thing I would say is you are the child's biggest role model. So whatever you are doing as a husband and wife, you are interacting in a patient, lively manner, and you respect each other. They know how an individual should be respected, how a family should be there. So if you are shouting in front of the children, between both husband and wife, the children carry that, and they think that this is the way that we react. If there is a problem, you don't solve, we just shout at each other. So instead, in front of them, you put an example. Okay, this is a conflict. Let us try and solve it. The children imbibe that what is going on in front of them. If you are having a healthy lifestyle, you are sleeping on time, you are eating on time, and what food you are eating, you are sending lot of messages to these children who are observing you. Apart from the teachers who keep changing, you are the only constant person for them. So you are the biggest role model ever you can provide to your children. So be the best so that your children can be the best.
So thank you, sir, for sharing your expertise and wisdom with us today. And it's a privilege and honor to have you on a program.
Thank you. Thank you very much.